Good afternoon, everyone. I am Dr. Arpit Garg. I am working as an endocrinologist at Aman Hospital, Patiala. Today, I am going to tell you some things about hypertension, which means high blood pressure, and diabetes, which means high blood glucose levels. Both these diseases are caused by a bad lifestyle or improper lifestyle, which includes lack of exercise and bad diet. And the other contributory factor other genetic factors, which means family history of diabetes. If a person is having family history of diabetes or hypertension, then the risk of getting diabetes or hypertension is almost doubled. So, to protect ourselves from getting these diseases, we have to improve our lifestyle from the very initial stages, which means we should follow healthy diet from our childhood years. A healthy diet means we should take more proteins in our diet, less fats, more fiber, and less carbohydrates. Carbohydrates are the main culprit which cause most of the diseases in our body, like diabetes, cancers, hypertension, heart problems, brain problems. The major culprit in our diet is the carbohydrate and the fats. We should restrict the amount of carbohydrates in our diet. From the very early age, or we can say from our childhood, we should try to take balanced diet, which consists of approximately 50% carbohydrates, 35% calories from the proteins, and 10 to 15% calories from the fats. And rest about 25 grams of fiber must be consumed daily in any adult. We should restrict our salt intake to less than 5 grams per day. And smoking is very bad for health. We should stop smoking or we should not smoke at all. The people who smoke, they should absolutely stop smoking. Smoking is one thing which has a very, very bad effect on our heart, on our brain, and kidneys. The people who smoke, I always tell them if you are a smoker, then there is no use of the treatment of your hypertension or diabetes because smoking increases the risk of heart problems or the brain problems by approximately 10 to 20 times, whereas high blood pressure or high sugars increase the risk of heart problems by approximately 2 to 3 times. So if you are smoking, then there is no use of treatment of the other diseases like hypertension, diabetes, because smoking is the biggest villain in our life. Second is moderation of alcohol intake. People who take alcohol, they should not take alcohol more than once a week, and at one time, the alcohol intake should be kept to around 20 grams of alcohol per day, or you can say about 60 ml of whiskey per day or 1 pint of beer. Not more than that should be consumed once a week. Coming to the second part, we should exercise regularly. Approximately 45 to 60 minutes of moderate intensity physical activity should be done daily for at least 5 days in 1 week. And people who are young, they should do approximately 30 minutes of strength training, which includes weightlifting or dumbbells or treadmill. They should do these exercises for approximately 30 minutes, along with the moderate intensity physical activity. People who are elderly or more than 65 years of age, for whom the strength training is difficult, they must do approximately 60 minutes of moderate intensity physical activity, which includes like brisk walk of approximately 60 minutes. Along with that, they should practice yoga for approximately 30 to 45 minutes per day. If we follow this pattern of lifestyle, then we can protect ourselves from the long term diseases like diabetes, hypertension, heart problems. On the other hand, if we see nowadays, children from the very beginning, they are not exercising, they like to play games on the mobile or computers, they are not going into the fields, and they like to eat the calorie intense foods from the various fast food corners, and they don't like the home cooked food. And these are the patterns, lifestyle patterns, which increase the risk of these chronic diseases. People, or we can say as adults, we are not very careful for our children regarding their diet and exercise because we feel that these are their childhood years And why should we restrict them from taking sweets or the high calorie foods? But you must know one thing, that all these diseases like diabetes or hypertension or heart problems, they start in the childhood years. It doesn't mean that children start getting high blood sugar levels or high BP levels. The basic pathogenesis or the basic defect of these diseases start in the childhood years, in the first 10 years of life. And if we are not controlling our children in those years, that is the first 20 years, then they will have hypertension or diabetes in the early age. That is in the 30s, they will start developing these diseases. On the other hand, if the children are having very good lifestyle in the first 20 years of their life, then they can protect themselves from these deadly diseases till late age, like till 50s or 60s, they may remain healthy, and after the age of 60, they may develop these chronic illnesses. So, a habit of good lifestyle is very important for the children. If we come to the diabetes part, diabetes is one disease which affects all your organs, straight from your head to your feet. Almost all the organs are affected by diabetes. If your diabetes is well controlled, even then your organs are affected in approximately 20 to 30 years' time. But if your diabetes is also not well controlled or your blood glucose levels they remain high, then you will see that your organs will show some effects of diabetes in 5 to 6 years time, and these are called as the complications of diabetes. So the complications of diabetes are determined by two factors. One is the duration of diabetes and second is the control of diabetes. We cannot control the duration because as we age, as we grow old, the duration of diabetes is going to increase, but control of your disease or control of your diabetes is in your hand. If you are not controlling your blood glucose levels, you will develop complications in a short time, like 5 to 10 years. However, if you are controlling your diabetes, you may stay away from the complications, or the complications will develop at a later time, like after 20 to 30 years of diabetes. To control your diabetes, there are two aspects. One is the checking your blood glucose levels or monitoring of the blood glucose, and second is the treatment of the high blood glucose levels. And last but not the least is the treatment of comorbidities like high cholesterol levels and high blood pressure levels. So there are ABC of diabetes. A stands for HbA1c, which is the 3 months average blood glucose levels. B stands for blood pressure, and C stands for cholesterol. If you are controlling all these three things, then you can stay away from the complications of diabetes for a long time. A standard HbA1c target of less than 7% is kept in the population. If you're a diabetic, you should keep your HbA1c less than 7%. However, in young individuals like who are less than 50, we try to maintain a target of less than 6.5%. Second comes the control of blood pressure. We all must try to keep our BP less than 135/85. And if your BP is consistently above this target, you should meet your doctor and start a medication for high BP. And if you're already on some antihypertensive drug, then you should ask your doctor to adjust the medication accordingly. Third comes the cholesterol levels. We should try to keep our cholesterol within the normal range, which means we should try to keep our LDL levels, which is the bad cholesterol, less than 100. And in those patients who are diabetic, we should try to keep LDL less than 70, which is the most important cholesterol. And targets for the other types of cholesterol, like good cholesterol, which is HDL, we should try to keep it more than 45. And triglycerides, we should try to keep less than 200. So if we are able to maintain our cholesterol levels within the desired targets, we can protect our heart, protect our brain and kidneys from damages for a long term. So in a nutshell, I would like to tell you that you should monitor your health. You should get general tests like blood sugar levels, cholesterol levels, BP check, general eye check, kidney test, liver test, at least twice a year. And if you are having any disease, get the treatment early. And the Most important aspect of the treatment is good lifestyle, which includes diet and exercise. If we are able to follow good lifestyle, then we can protect our body from these deadly diseases for a long term or till a late age. Thank you. Thanks a lot.